Hello everyone. Today, we're going to talk about a very important topic for anyone living with heart failure or caring for someone who does, preparing for emergencies. While managing heart failure is an ongoing journey, knowing what to do when an unexpected crisis arises can make all the difference, potentially saving lives and improving outcomes. We'll cover key emergency events, what steps to take, and what medications, if any, you should have ready for immediate use. Remember, all of this information should always be discussed and personalized with your own doctor. Before we dive into specific emergencies, it's crucial to understand the foundation of emergency preparedness, your personalized heart failure action plan. Every heart failure patient should work closely with their doctor or care team to develop this. This plan typically categorizes your symptoms into different zones, often green for stable, yellow for caution, and red for emergency. Today, our focus will be primarily on those red zone emergencies, what those look like and what immediate actions to take while professional help is on the way. Heart failure patients are at risk for several types of emergencies, each of which requires a specific and timely response. We'll go through each of these critical events: acute decompensated heart failure, which is often about fluid overload, acute ischemic events, like a heart attack, serious irregular heart rhythms, stroke, and severe internal bleeding, especially if you're on blood thinners. Understanding the unique signs and actions for each is key. Our first and most common emergency is acute decompensated heart failure. This means your heart's pumping ability has suddenly declined, often leading to a rapid buildup of fluid. Look out for rapidly worsening shortness of breath, especially when lying flat, or if you wake up gasping. Also, sudden, significant weight gain like 2 to 3 pounds overnight, or increased swelling in your legs, ankles, or abdomen. You might also have a persistent cough, severe fatigue, or discomfort from swelling. If these symptoms are severe, call 911 immediately. While waiting, help the person sit upright to ease breathing, loosen their clothing, and stay calm. Do not give them anything to eat or drink, and have their medical information ready for the paramedics. For acute decompensated heart failure, the primary emergency medication you might carry is an extra dose of your diuretic or water pill. However, this is critically important. Only take this if it has been specifically prescribed and instructed by your doctor as part of your personalized action plan. Your doctor may tell you to take an extra dose of a specific diuretic, like furosemide, if you experience rapid weight gain and shortness of breath. This helps to quickly remove excess fluid. But never self-adjust your diuretic dose without those clear, prior instructions from your healthcare provider, as it can be dangerous. Next, an acute ischemic event, commonly known as a heart attack. This is a sudden blockage of blood flow to the heart muscle. Look for severe chest pain, often described as pressure or squeezing, that might spread to your arms, jaw, or back. You could also experience shortness of breath, cold sweats, nausea, or sudden dizziness. In women, unusual fatigue can be a more subtle sign. If you suspect a heart attack, call 911 immediately. Tell the dispatcher you suspect a heart attack because time is crucial for saving heart muscle. While waiting, help the person rest, loosen their clothing, and do not give them anything to eat or drink. Be ready with their medical information. For a suspected heart attack, the only medication you might be instructed to take at home is aspirin. However, this is very specific. Only take aspirin if you are told to do so by a 911 dispatcher. If instructed, chew a non-enteric-coated aspirin, usually 160 to 325 milligrams, and swallow it. Chewing helps it work faster. It is critically important not to take aspirin unless you're explicitly told to, because if the symptoms are due to a bleeding event, like a hemorrhagic stroke, aspirin would be harmful. This action is only for suspected heart attacks. Our third emergency involves serious arrhythmias, or irregular heart rhythms. Heart failure patients are prone to these. Symptoms can include a sudden very fast or very slow heartbeat, palpitations, dizziness, fainting, severe shortness of breath, or sudden weakness. If you have an implantable cardioverter defibrillator, or ICD, your device might deliver an internal shock. Do not interfere with the device. However, if you receive more than one shock, lose consciousness, or don't improve after a shock, call 911 immediately. In any case of suspected serious arrhythmia, call 911 right away. Help the person lie down, check their breathing, and be ready to perform CPR if they become unconscious and stop breathing, guided by the dispatcher. For serious arrhythmias, there are no medications that you should carry for self-administration at home. These events require immediate, professional medical assessment, often including an electrocardiogram, and advanced interventions that can only be performed in a hospital setting. While an ICD may deliver an automated shock, that's a device response, not a medication you administer. Our fourth emergency is stroke. This happens when blood flow to the brain is interrupted, an ischemic stroke, or a blood vessel in the brain ruptures, a hemorrhagic stroke. Remember the FAST signs: face drooping, arm weakness, speech difficulty. If you see any of these, it's time to call 911 immediately. Other signs include sudden numbness, confusion, vision problems, or a sudden, severe headache. When you call 911, tell them you suspect a stroke, and most importantly, note the exact time symptoms started, as this is critical for treatment. While waiting, help the person lie down safely, and if they're vomiting, position them to reduce aspiration risk. Do not give them anything to eat, drink, or any medications, especially not aspirin, as it could be harmful if it's a bleeding stroke. Stay calm and gather their medical information. Similar to serious arrhythmias, for a stroke, there are no medications that you should carry for self-administration. The immediate priority is getting to the hospital quickly for a definitive diagnosis, usually with a brain scan, to determine the type of stroke. Administering the wrong medication at home could be incredibly dangerous, especially if it's a bleeding stroke. Time is brain, so getting to professional care is the key action. Finally, severe internal bleeding. While not unique to heart failure, it's a higher risk if you're on blood thinners, which many heart failure patients are. Look for signs of shock due to significant blood loss, a noticeable drop in blood pressure, a rapid heart rate, and rapid, shallow breathing. The person might be pale, clammy, dizzy, confused, or extremely weak. You might also see visible signs like bloody vomit, black tarry stools, or unexplained severe bruising. If you suspect severe internal bleeding, call 911 immediately. Help the person lie down, keep them warm, and if possible and safe, elevate their legs. Crucially, do not give them anything to eat, drink, or any medications, especially aspirin or other blood thinners, as these would worsen the bleeding. Be ready with their medical history, particularly if they are on blood thinners. For severe internal bleeding, there are no medications you should carry to administer at home. This is a critical emergency that requires immediate hospital intervention to find the source of the bleeding and stop it. While hospitals have specific medications to reverse the effects of blood thinners, these are potent and complex treatments that can only be administered and managed by medical professionals in a hospital setting. Beyond specific emergencies, general preparedness is vital. Always wear medical identification like a medical alert bracelet. Keep an up-to-date list of all your medications handy, consider a vial of life or digital copy. Have emergency contacts readily available, and most importantly, educate your loved ones so they know your action plan and how to help. Keep your doctor's contact information accessible, and always know your baseline, that's your normal weight, blood pressure, and symptom level, which helps you and your doctor recognize when something is truly abnormal. This slide highlights a critical best practice. Always get written instructions from your doctor for any medication you might carry for emergency use. While we've discussed limited scenarios where this applies, having these instructions in writing ensures safe and appropriate use tailored to your specific health. It also provides clear guidance for any caregiver or emergency responder. Each instruction should be brief, ideally signed by your provider, explaining exactly when to take the medication, the proper dosage, when not to take it, any special precautions, and what follow-up steps are needed. Keep these notes with your emergency kit and review them annually or after any medication change. Here's a template you can use or show to your doctor to create these personalized emergency medication instructions. It's a clear, concise way to document everything necessary for safe use. For example, for furosemide, it would clearly state the indication, dosage, when not to take it, and critical follow-up actions. This template is designed to ensure you and anyone assisting you has all the vital information at hand during a critical moment. To summarize our discussion, the most powerful tool in any heart failure emergency is rapid recognition of symptoms and immediately calling 911. Remember that the medications you might carry for self-administration are very limited and always require explicit, doctor-written instructions for specific scenarios. Always work closely with your healthcare provider to personalize your emergency action plan. Being prepared, staying calm, and communicating effectively are your best defenses in a critical situation. For further information and to ensure the accuracy of the information presented, here are some of the primary sources we've referenced from leading medical organizations. You can visit their websites for more in-depth information on heart failure, heart attacks, and stroke. Please remember that the information is for educational purposes only and does not replace the advice of a medical professional.